morning. We want to talk about a little bit of how we engage our clients and our patients as it relates to taking exercises out of the clinic and back at home, okay? What the research tells us, without getting into a lot of detail, is we got to educate and demonstrate to our patients. It can't just be a straight leg raise or a quad set or an external rotation. Our patients aren't going to do them, okay? So how do we educate and demonstrate? Case in point, I had a lady recently come into the clinic, had a fractured elbow. Her mobility was minus 60 to 80 degrees. So she only had a 20-degree arc. Pretty straightforward. We said, here's your home program, move it, bend it, right? So here's your home program. She comes back 2 days later. I say, how are you doing? How was your home program? She says, I didn't have time to do it. How do you not have time to just move it and bend it? And then we realized, because we weren't taking it back to function. We weren't taking it back to something that was meaningful to her, okay? So I asked her, I said, what do you want to do when you're talking about moving it and bending it? What do you need to be doing? She said, well, I really want to wash my hair. I can't touch my hair. There's our opening. We found something that was functional, something that we can tie it back to a home program. And so from then on, we said, well, here's your home program. We are going to move to try to touch your hair. And you can bend your head, you can move it, try to touch your chin, your nose, and so forth. Every visit she came back into the clinic, she said, look what I could do. I could move it, I can bend it, because it was tied to something functional, okay? So if we take something as broad a topic as knee pain, what do we think about doing for our patients with knee pain? We could say, oh, well, here's your straight leg raise, here's your quad set, those type of activities. But guess what, guys? Patients won't do them. So how do we engage them to move it and to use it? Very simple. We got to try to tie it to function. And I think the biggest error that we make as clinicians is we go after strengthening first instead of mobility. So if we think about functional rehab as mobility, then go for the stability. So if I have my patient here, John, and I say, how do we want to start working on knee pain? I want to start looking at mobility of tissues first. So if I take a product like the roller here, I can start thinking about clinical soft tissue components of the knee. So I literally may say, John, where does the pain hurt you?
On my knee.
On his knee. But does it hurt when he's lying in bed, sitting in a chair? No. No one hurts there. So it hurts with what? Walking, stepping, something functional, stepping forward, things of that nature. So we can take a foam roll like this. John, take that. We're going to do it together. And we can go into, maybe we start sitting on a chair. So now maybe we're sitting here on a chair, and we take the foam roll and we address soft tissues around the knee. So we're going to go in and we're going to roll the calf. So we're going to mobilize the soft tissue. All of a sudden the patient's engaged a little bit and says, yeah, I feel some soreness there, let's work on that. Then we can work the patellar tendon. Any of you familiar with like Graston technique, A-stem, factor, these type of techniques? This all started from this technique right here, rubbing an instrument over the patellar tendon. And so we mobilize the calf, the patellar tendon, and then what about the quads and the thighs themselves? So again, mobilizing the soft tissue. So we start with mobility, but let's take it from there. Let's go into something more functional. John, stand up. The role of the glute medius, okay? Everything we do functionally as it relates to the knee is controlled by our lateral hip and our medial component rotators. So when I take a step and I'm standing and the other leg is swinging, that hip has to hold me up. If not, what do we have? Trendelenburg, a dropping, things of that nature. So why not get our patients engaged in mobility techniques for that component, which is going to have a direct effect on the mechanics of the knee. So now, how do you do this at home if you don't have some sort of cheat sheet or cheater? You got to use a roller. So we come into our glute med, and we can very simply work the lateral aspect of that thigh into the hip, and we start mobilizing. Mobilize before we stabilize. So very quickly to summarize, we rolled the calf, we rolled the patellar tendon, we rolled the quads, and now we've rolled the glute medius. We get ourselves mobilized. If you want to take it one step further, why not take it into the QL and release the QL and maybe progress your patients to single leg standing and work that fascial component as a component of a good quality knee program. All right, so we've mobilized. Now let's take it to the next step. How are we going to focus on strengthening? Well, let's look at the advantage of something as simple as the CLX band, okay? We can use this to do open and closed chain exercises. So instead of just a quad set, we can take this band, loop it around the knee, secure it to an anchor, And then John can be taught to push back into that. And he can be doing his quad sets there. Patients aren't going to go home and do a quad set just on the ground. But if you give them something functional, that is standing, and all of a sudden now they can do their quad set, now all of a sudden they're engaged in a movement activity. Okay? So this becomes their home program day one. We can then engage proprioception a little bit more. So we can take something like a stability pad, 2 of them, put our patient on the stability pad, take that same band around the knee, and now encourage the same active motion of a functional quad set. So here's John working this, but we've added the component of proprioception. We can take this a step further. We can then go to single leg stance. So John will go here, we'll kick one out, and we can progress. So we've mobilized, now we're working on functional stability. Again, closed chain, quad sets in this area, okay? So it's a functional exercise stimulating that quad, that distal quad in multiple functional positions. We talked about the importance of the glute med. Again, the CLX bands have the loops on them. So now we can actually loop this through a foot, find an additional loop, loop the other leg, okay? And now we can use this band here to do functional activities such as drop step, okay? Or working into lunge activities, forward lunge, or reverse lunge. So we've mobilized the tissue, we then look for functional strengthening activities. Lastly, as we engage, last thing we would engage for a home program is maybe give them some stability. Let's slip out of that a little bit. And we can use a product. We're all familiar with various kinesiology tapes on the market, but how does your patient know how to properly apply that tape at home? If we use the exact stretch, we can teach them to effectively pull on a consistent basis, 25% or 50%. So I could simply have John come to a chair, teach him how to pull that tension through the key indicator, bring the knee down, and simply apply on that patellar tendon to the amount of tension that we want, and then pull and apply the application or apply the tape. With other taping products out on the market, it's going to be a little bit more confusing for the patient population. So the advantage of the exact stretch from a home exercise program compliance standpoint is a lot easier. The patient knows how to utilize it. So to summarize, we want to look at functional activities. How do we tie the home exercise program to function? Can we mobilize the soft tissue, the calf, the patellar tendon, the quadriceps, the lateral thigh, and importantly the glute med and the thoracolumbar fascia? All easily done with a roller at home. And then how can we functionally stabilize? CLX bands, standing quad sets, single leg, double leg progression, and then finally taping for aftercare support of the knee with the exact stretch tape. These are just simple ideas utilizing various products out there to engage our patients in a home exercise program.